Morning everyone. So today we are going to discuss a class on Virginia Henderson's nursing need theory. Okay, let's see the content which we are going to discuss. We are going to discuss regarding the background information, that is who is Virginia Henderson and how she developed this theory, and assumptions of her theory, concept of the theory, then components of Henderson's nursing need theory, the strength and weakness of a theory, and applications of this theory to nursing process. So we'll see who is Virginia Henderson. So Virginia Henderson or Virginia Avenel Henderson, which was born in November 30, 1897 and died on March 19, 1996. She was also a nurse, theorist, and also an author. She was known for her need theory and defining nursing as the unique functions of the nurse is to assist the individual, sick or well, in the performance of those activities contributing to health or its recovery, or to a peaceful death, that he would perform unaided if he had a necessary strength, will, or knowledge, and to do this in such a way as to help him gain independence as rapidly as possible. So this is the definitions given by her, which define the nursing. Then she is also known as the first lady of nursing, the nightingales of modern nursing. Not only that, modern day mother of nursing, and the 20th century's Florence Nightingale. Okay, so Virginia Avenel Henderson was born in 1897 in Kansas City, Missouri. Okay, then she was also known as the Nightingale of modern nursing, modern day mother of the nursing, and the Florence Nightingales of 20th century. Let's go to her career, nursing career. So her nursing career was started from Army School of Nursing at Walter Reed Hospitals, Washington, D.C. in 1921. And after that, she received a Bachelor of Science degree in 1932 and completed master degree from Teacher College at Columbia University in 1934. Then later on, she worked there in the same institution, that is in Teacher College at Columbia University as a faculty. Then later on, she worked as a research associate at Yale University's School of Nursing since 1953, and then in that institution, she earned the titles that the First Lady of Nursing. Next, not only that, she even received an honorary doctoral degree from the Catholic Universities of America, Pace University, University of Rochester, University of Western Ontario, and Yale University. Then she even published some books. In 1955, she published her definitions of nursing in a textbook called The Principles and Practice of Nursing, and in the year 1966, the book name is Nature of Nursing. She clearly defined the definitions of nursing there. Then she was also a well-known person for her need theory and defining the nursing. Not only that, she was also an author, nurse, teacher, theorist, and even a researcher. Then she was died on March 19, 1996 when she was 98 years old. Let's see how she developed this Henderson's nursing need theory. Why we are calling need theory? Because she identified some component, that is 14 components in her theory, and not only that, she even emphasized regarding defining the nursing definitions. Okay, in this theory, she defined the unique focus of nursing practice and even emphasized on the basic human needs and how nurses can assist in meeting those needs. Her concept in this theory was to increase the patient's totally and independently persons. Later on, she was one of the first nurses to point out that the nurses does not consist of merely following physicians' orders. Nowadays, nurses used to follow only the physician's orders. We assume like that. But in her theory, she is clearly specifying that nurse is not only following the physician's order. Then she even proposed 14 components which is required for effective nursing care. If we identify these 14 components, we can deliver an effective nursing care. From her theory, she is explaining here. Then she described the nurse's role as a substitutive, supplementary, complementary, with the goal of helping the persons become as independent as possible. She described here the role of a nurse in three ways. Substitutive. Substitutive means here the persons or the nurse is going to do the work for the patients. Let's take an example. The patient is not able to do the daily activities for daily activities. So here the nurse is going to substitute it. Then supplementary, she is going to help him. Then complementary, she is going to work together with the patients so that in order to achieve as independently as possible. Okay, then she even defined the definitions of nursing. So the definitions of nursing nowadays is very common, these definitions. The unique functions of the nurse is to assist an individual sick or well in the performance of those activities contributing to health or its recovery or to a peaceful death that he would perform unaided if he had the necessary strength, will, or knowledge, and to do this in such a way as to help him gain independence as rapidly as possible. Here in her definition, she is defining that the patient should be and independently can do his daily activities. So that is her main motto in her definitions. So the nurse should focus in his nursing practice, that is the care. By giving the care, he or she, the patients, should able to do his or her daily activities independently. So according to her theory, she gave four assumptions. So let's see what are those four assumptions. First is what? The nurses care for the patients until patient can care for themselves once again. The nurse is going to deliver the care until and unless the patient can able to do by themselves. Then patient desire to return to health, but this assumption is not explicitly stated. From her second assumption, he is telling that the patient is desired to return to health. But in this assumption, she doesn't explain it properly. Then nurses are willing to serve and that nurses will devote themselves to the patients day and night. Here in this third assumption, she is telling that the nurse should be willing to work whether it is day or night. That means what? She will be totally devoted in his or her tasks. Last one, nurses should be educated at a university level in both art and science. These two basic things, that is art and science, is needed when a nurse when the nurses want to deliver a care to the hospitals. Next, major concept of the theory. According to Henderson's nursing need theory, she identified four concepts. In those four concepts, we'll see First is the person, second is the environment, third is the health and nursing. In this four concepts, we are going to see one by one how she assumed these persons in this theory. Persons or individual. Persons or individual here is the patients. So persons means have a basic needs that are components of health, then require assistance to achieve health and independence or a peaceful death. Considers the biological, psychological, sociological, and spiritual components. Next, we'll see environment. Here in her theory, environment means what? The external conditions which affect the growth and development of an individual. Next, health. Health refers in her theory here is defined as based on the individual's ability to function independently as outlined in the 14 component, which we are going to discuss in the next. Then, nurses need to stress promotions of the health and preventions and cure of diseases. Next, good health is a challenge which is affected by it may be because of the age, cultural background, physical and intellectual capacities, and emotional balance. Is the individual's ability to meet these needs independently. Next, we will see nursing, how she defines nursing in her theories. So nursing means what is a temporarily assisting an individuals who lack the necessary strength, will, and knowledge to satisfy one or more of 14 basic needs. In this theory, in her theory, she defined 14 basic needs. If a nurse is going to satisfy these one or more 14 basic needs by assisting an individual, this is called as nursing. Then, nursing means by assisting and supporting the individuals in life activities and attainment of independence of a persons. By delivering or assisting and supporting the individuals, he will be totally independent. Then, nurses serve to make patients complete, whole, or independent. Then the nurse is expected to carry out physician's therapeutic plan. Whatever therapeutic plan is given by the physician, the nurse is expected to carry out. Not only that, individualized care should be delivered to the specific patients or the individuals by planning a care for the patients. Then, not only that, she even gave us definitions of nursing. Then she even proposed for using a nursing research. Next, we'll see 14 components of Virginia Henderson's needs theory. Okay, so first is the breathe normally. Second is the eat and drink adequately. Then eliminate body waste. Third. Fourth, move and maintain desirable postures. Next, sleep and rest. Then select suitable clothes that is dress and undress. Then maintain body temperature within normal range by adjusting clothing and modifying environment. Keep the body clean and well groomed and protect the integument. Avoid dangers in the environment and avoid injuring others. That is safety for the patients. Communicate with others in expressing emotions, needs, fear, or opinions. Worship according to one's faith, that is spirituality. Then work in such a way that there is a sense of accomplishment. Play or participate in various forms of recreations. Last one, learn, discover, or satisfy the curiosity that leads to normal development and help use the available health facilities. So these are the 14 components of Virginia Henderson's needs theory. If a nurse wants to deliver a care, he or she should know these 14 components. By identifying these 14 components, he can deliver the nursing care to the patients. Okay, here what she is telling is the first 9 components, starting from the breathe normally till avoid dangers in the environments and avoid injuring others. These 1 to 9 components she is considering as a physiological needs. Then component number 10 and 11, 10 and 14. That is 10 and 14 are psychological aspect of communications and learning she is considering. Then the 11 components as a spirituals and moral. So in the 11 components is worship according to one's faith. Here this 11 component is considering as a spirituals and moral. The last one, 12 and 13 components, that is the play or participate in various forms of recreations, then work in such a way that there is a sense of accomplishment. This too is considering as sociologically oriented to occupations and recreations. So these are the 14 components which is given by the Virginia Henderson's. So how they are dividing, how they are showing in this diagram, these 14 basic needs according to the Virginia Henderson's. Next, we'll see the strength and the weakness of the Virginia Henderson's. Obviously, there will be some weakness. Then, apart from that, there will be some strength of this Virginia Henderson's. We'll see first the strength of the Henderson's needs theory. Okay, so the theory of this Virginia Henderson's is very simple. Not only that, it can generalize to other. Then applications to help of individuals of all ages. Not only we can deliver to a specific infants, not only infants, we can use this theory to the adult, either it may be geriatric. Then assist in increasing the general body of knowledge within the disciplines. By using this theory, we can expand the body of the knowledge within our discipline. Then her ideas of nursing practice are well accepted, especially the definition which was given by her is well accepted. Then can be utilized by practitioners to guide and improve their practice. Whatever 14 components is giving, we can utilize these in order to guide and improve our practice. Then we'll see what are the weaknesses of Virginia Henderson's theory or need theory. Then here what they're telling is that there is a lack of linkage between the physiological and other human characteristics. Whatever the 14 components he have given, there is no linkage between them. Then no concept of the holistic natures of human being. He doesn't explain or neither she didn't include the holistic natures of human being in this theory. Then if the assumptions is made that 14 components are prioritized, the relationship among the components is still unclear. Then assisting the individuals in the dying process, she contend that the nurse helps, but there is little explanations of what the nurse does. There is little more explanations needed regarding what she have given in the assisting the individuals in the dying process. Okay, this is regarding the strength and weakness of the Virginia Henderson's needs theory. Okay, then let's come applications of the Henderson theories in our nursing process. We all know in the nursing process, there are nursing assessment, diagnosis, planning, implementations, and evaluations. So the things which we are going to focus in the nursing assessment is the 14 components of basic nursing care. So which we discussed there in the 14 components in her theory. So we are going to assess those 14 components Especially, let's take an examples when an infant complains of breathing difficulty with malnourished. So in that point, we are going to identify that whether the patient is breathing normally or not. Elimination patterns, we are going to check. Drink water, whatever things we are going to check it. So by identifying those problems, we are going to list down those uh, problem by linking with that 14 components. Okay, then after identifying those problems, we are going to diagnose a nursing diagnosis. So identify individual ability to meet our needs with or without assistance, taking into considerations strength, will, or knowledge. Okay, so we are going to identify the problem, whether the patient is able to meet their own needs by themselves or with the help of the assistance, by taking into the considerations that strength, will, or knowledge of the individuals. Then after diagnosing the problem, we are going to use the nursing diagnosis. If the patient is having breathing problem, we already identify it, then we are going to use ineffective breathing pattern related to whatever problem is there. Then we are going to next step, we are going to carry out the nursing plan. Then document how the nurse can assist the individual sick or well. So we are going to plan it. If the patient is having breathing problem, what kind of planning we are going to use? Either it may be oxygen administrations, semi-polar positions, then oxygen administrations, whatever things we are going to plan it out. Then nursing implementations. Then after planning it properly, we are going to implement it. Assist the sick or well individuals in the performance of activities in meeting human needs. So by identifying whether the patient can able to do by themselves or with the help of the individuals, by identifying those things, we can identify it whether the patients can able to meet those needs in order to maintain health, recover from illness, or to act in peaceful death. So what are the things we should keep in mind for the implementation is we should always implement the things based on the physiological principle, age, cultural background, emotional balance, and physical and intellectual capacities. Then nursing evaluations. So after all, when we complete all those assessment, nursing diagnosis, planning, and implementations, we are going to evaluate it. We are going to check it whether it is effective or not. So use the acceptable definitions of the nursing and appropriate laws related to the practice of nursing. So the quality of the care is drastically affected by the preparations and native abilities of the nursing personnel rather than the amount of the hours of the care. Successful outcomes of the nursing care are based on the speed with which or degree to which the patients perform independently the activities of daily living. So this is regarding the applications of the nursing process in applications of nursing process of Henderson's theory. So here comes the conclusions. Henderson provides the essence of what she believes is definitions of nursing. She didn't intend to develop a theory of nursing, but rather she attempted to define the unique focus on nursing. So her emphasis on basic human needs as a central focus of nursing practice has led to further theory development regarding the needs of the persons and how nursing can assist in meeting those needs. So by completing her theory, what she focused here is the importance of increasing the patient independence. Not only that, by emphasizing basic human needs and how nurses can assist in meeting those needs. Okay, this is regarding the Virginia Henderson's theory or nursing's need theory. With this, I would like to conclude.